Thank you for joining me again as we continue our discussion on the show Your Doctor and COVID. I'm Dr. Mahendra Carpen, the Head of Medical Services and Cardiology at the Georgetown Public Hospital Corporation. Remember, if you have questions for us, please feel free to send them in by WhatsApp at 620-6275 or send an email to docandcovid@gmail.com. As usual, I'm going to start off by demonstrating that we wear our mask correctly in a manner that covers both the nose and the mouth. I'm going to take this off because I'm alone as we're recording this program and no one is here to put me at risk, and I'm not putting anyone else at risk. So we continue to receive lots of questions from viewers and listeners just like yourself, and many persons are actually concerned about people that they know. And as we go more and more into this pandemic, almost every one of us will know someone who has been ill or who would have tested positive for COVID-19. So it's going to become more and more common. I believe we are now past 4,500 cases in Guyana, and we are about 135 or thereabout persons who would have died after testing positive for COVID-19. So let's look at the question and the scenario that was posed by a concerned friend for someone. And this is a very important question as we enter into what is commonly expected to be the flu season, and people are going to start to wonder, is this coronavirus or is this the common flu or common cold? And so we'll spend some time today to look at the differences and to help us all understand how to approach these common and overlapping symptoms that can mimic various conditions. So here's a scenario and a question. I have a 76-year-old friend who woke up with a sore throat. So the 76-year-old friend woke up with a sore throat. By the next day, she developed fever, runny nose, headache, and sneezing. 5 days later, the fever, headache, and sore throat have gone. And now the runny nose has worsened, the head feels heavy, and the question is, could this be COVID or just the common flu? Well, we know that the flu occurs every year, and this has been so for quite a number of years. The COVID-19 pandemic has been with us for just 1 year. We don't know if this will be something that continues, and if it does continue, how long it will continue for. So it's important for us to look at some of the common features. We have oftentimes something that we call a cold and then something that is a flu. While there are many overlapping symptoms and complaints, there are also some unique features, and it's important for us to understand what these differences are so we could make informed choices and in some cases to become less anxious. So the signs and symptoms and the differences between a cold and a flu are many. So let's look at the onset of symptoms. For a cold, the onset is quite gradual, but a flu, it is more abrupt and sudden. In a cold, it is rare to have fever, but fever is a very usual and common feature of the flu. The body aches can be slight in a cold, but it's very usual and common in the flu. Chills are uncommon in cold, but fairly common for the flu. Fatigue and weakness can be seen sometimes in cold, but it's usual in the flu. Sneezing is quite common in the cold, but it is only seen sometimes in flu. Chest discomfort and cough sometimes is mild to moderate in the cold, but it's quite common in the flu. Stuffy nose and sore throat is common for the cold, but are only seen sometimes in the flu. And a headache is rare in a cold, but it's quite common in the flu. The cold is mainly activation of the sinuses and that kind of inflammatory response. The flu is actually caused by a virus that produces an infection, the influenza virus. If we look at the coronavirus versus the flu versus allergies. So the coronavirus has very common features: fever, cough, shortness of breath or difficulty breathing, and the symptoms can appear between 2 to 14 days after the exposure. In the flu, we also have fever and cough, but additionally muscle aches, chills, sweats, congestion, and sore throat. We are seeing that many persons are actually also having sore throat with COVID-19. Allergies, however, are completely different. That is more when there's a lot of sneezing, itchy nose, eyes, or runny nose, stuffy nose, watery, red eyes, etc. That's more common in allergies. So it's important to recognize the difference. Not every cough means COVID, and definitely there are many things that can cause fever and the other symptoms associated. The overlap between flu and COVID both of them are actually transmitted by respiratory droplets from an infected person, and both can have fever, cough, and fatigue. However, in the flu, the symptoms usually start between 1 to 4 days after exposure, whereas in COVID-19, the symptoms start 1 to 14 days after exposure. The cause for the flu is influenza virus, and in COVID-19, the cause, of course, is the SARS-CoV-2 virus, which is the novel coronavirus. Complications can occur more often in COVID-19, and these include severe pulmonary or respiratory complications, and these may come on quite quickly. The complications are less likely to occur in the common flu because a lot of persons have developed some type of immunity which reduces the severity of complications. We do have a vaccine which is fairly effective in the flu, but now we are developing vaccines to the COVID-19 infection. So there's lots of promise, and we're going to talk about vaccine sometime in the near future for COVID-19. The severity or the case fatality rate for the flu versus COVID-19 is quite different, and the difference is quite significant. Let us look at what really is the case fatality rate. This is the ratio between the number of deaths and the number of persons or people infected. For COVID-19, the case fatality rate is 40 per 1,000. So 40 persons for every 1,000 who are infected will die. Versus the flu, where the case fatality rate is 1 per 1,000. So there's a 40 times difference in the case fatality rate of COVID-19 versus the common flu. And that's quite a big difference in those two. You remember some time ago in 2009, 2010, there was a big dangerous flu outbreak we referred to as the H1N1 flu. Now, even at the worst of that, if we looked at what happened for the whole year in 2009 to 2010, from April to April, there was a death rate of under 10 to 15,000. But if you look at what happened in COVID-19, which is this year from February to July 2020, the fatality or the death rate in the US has been over 130,000. So in a whole year, the H1N1 flu would have caused less than 20,000 deaths. But in this short period, February to July, that's less than 6 months, the death rate or the deaths accumulated was more than 130,000. And that is quite significant in terms of the difference and the number of persons who can die from COVID-19. The differences are quite remarkable. The flu mortality rate is 0.1%, whereas coronavirus can go up to about 2%. In fact, many countries that has been even higher. Antiviral medicine and vaccines exist for the flu, but we are only now developing vaccines for the coronavirus. The flu is seasonal and comes back every year, but it is unknown if the coronavirus will actually do the same. The incubation period for flu is 5 to 7 days, and for the coronavirus, it's 14 days. Experience and immunity to the coronavirus is actually quite minimal. It's only been a year now since we have discovered this, whereas the flu has been around for about 500 years or more. So there's a lot of experience in dealing with this at all levels. The similarities, however, they both originate in animals. They both can cause fever and cough. They can both cause death by respiratory failure. They are both spread by respiratory droplets. They can both be prevented by good hygiene and limited contact with those who are infected. And both can be contagious actually before symptoms have started. Both can cause a viral pneumonia, and viral pneumonias are very difficult to treat. It's quite different from bacterial pneumonia, where you can use antibiotics and you have better results on those. Both are actually transmitted through droplets, and they both pose high-risk complication possibilities for seniors and those persons who have significant underlying issues. And we have seen in the COVID-19, particularly persons who are ill with diabetes, kidney failure, heart disease, etc., those persons are at much higher risk for mortality or death and severe illness from the COVID-19. Lower risk for COVID-19 is seen in children. So that's one good thing about the COVID-19. It doesn't seem to be affecting children as severely as it does adults. If we look at specific markers for severity between the flu versus COVID-19, let us compare the severity of influenza or the flu and the coronavirus. In terms of hospital stay, the median hospital stay for those persons who would have been admitted with COVID-19 is 12 days versus admissions with the flu, they spend about 3.5 days. The hospital admission rate was about 10% for infected persons with COVID-19 and just about 1.3% for persons who are infected with the flu. The fatality rate is significantly different, over 3% in the COVID-19 group versus 0.1% in the flu period or the flu infection. And this is significant, and it's true across all risk group. And if you were to look at the very sick persons who are infected with either flu or coronavirus, even in the very sick ones, persons who are in hospital with coronavirus or COVID-19 have about a 40% mortality rate versus 19% who would have had influenza A or B or the flu. So all across the board, the coronavirus is much more dangerous than the flu, and it is important to be able to recognize and assume the worst, even though you may hope for the best. So persons with symptoms that could be either coronavirus or COVID-19 or the flu should assume it's COVID-19, get tested, and follow the precautions. So remember, if you have questions, feel free to send us a WhatsApp message on 620-6275 or send an email to docandcovid@gmail.com. Thank you very much for joining us today.